If you are still experiencing pain after spinal surgery, then you are not alone. If you saw my last video, I talked about how the statistics are as high as 75% of patients still have pain after surgery. Here are three common reasons why you may still be experiencing pain, and this excludes doctor and technical error. Number one is accelerated degeneration above or below the area of a fusion. So here's a depiction of a fusion where you can see the hardware fusing two bones together. And what happens is that the other joints above and below, because of that lack of movement, is overcompensated. So there's an additional load placed on those joints. So over time, you might experience degeneration or wear and tear. So essentially, the patient may have had a successful surgery for several years, have been symptom free until years down the road. Number two is what is the formation of scar tissue, also known as epidural fibrosis. This is a very common occurrence when it comes to surgery. There is going to be scar tissue that it develops when you do any kind of surgery. And it's not the scar tissue itself that is causing the pain, but when it is wrapped around the nerve root, it can cause that nerve to be inflamed. So the patient might experience lower back pain or even persistent leg pain after surgery. So typically, initially, they might experience some relief. However, it's temporary, and these symptoms might come out around 6 or 12 weeks after the surgery. Number three is that you either have a new cause of pain or it was never addressed or corrected in the first place. Particularly with lower back pain, there are many different causes, and it's never 100% certain what exactly is the source of pain. For example, there are many people that have disc herniations and they don't even know it because they're not exhibiting symptoms. Other sources of lower back pain and sciatica can include sacroiliac joint dysfunction as well as piriformis syndrome. A patient can concurrently have both things. Maybe they got surgery for the disc, but their real source of pain is something completely different.